Center of the conversation. From common illnesses to complex conditions to the questions you've always wanted answered. Top medical experts.
The cost of maintaining that bed on a daily basis 24/7, because an ICU is a 24/7 unit. One single bed can cost between 2 million and 4 million per day.
Real questions from the viewers, practical answers you can trust. Now, join us every Wednesday at 10 a.m. as we talk openly about issues that affect you and your family. Health Q&A talk show, your health, your say. Good morning to you. I know it's a chilly morning. Some of you are still stuck in the traffic jam. Some are still actually in bed with blankets pulled up over your heads. But yeah, it's the Health Q&A. My name is Sophia Matovo. Thank you so much, Robert Chiraba, for that wonderful talk on the Water and Environment Week that is just around the corner and for sharing those updates. Now, today, our discussion is going to focus on menopause, understanding the changes women experience. Now, there are certain times some people use it like a joke, but remember, it's a transitional period that most women go through. You hear some of them when somebody scolds them and they know their mom is above a particular age and they're like, that one, those are the menopause disturbing her. But I'm not the expert like I normally tell you in these bits, because it's a lot of things, brain fog. Recently, one of my friends who's hit 4th floor was busy telling me about how she wore a dress inside out. And she went to take her daughters to school. So everybody was just smiling as they were looking at her, but little did she know that she'd worn the dress the wrong way. So it's until when she got to the car and she realized it, she said she was embarrassed, had to wear the dress the right way. But I mean, this had happened. And sadly, nobody even tapped to tell her that you're wearing the dress the wrong way. The experts with me today are Dr. Moses Batwala, the medical director and founder of Fiona Fertility. And he'll be coming to us on Zoom all the way from Dubai. Dr. Moses, are you with us? Good morning. Are we joined by Dr. Moses? Okay, he'll catch us later. And then we also have Dr. Judith Ayikiriza, a fertility doctor, who is here with me in studio. Dr. Judith, good morning.
Good morning, Madam Sophie. Thank you for the welcome to this show.
Okay, you're most welcome too. Now you're going to, of course, set for us the bits and take us into what exactly it means when we talk about menopause. Let's start with what are menopause?
So menopause is really a stage in life where a woman is in non-reproductive life. What does it mean? Menopause is the last period someone actually has. Menopause is defined as having 12 months without a period. Yes, so when you talk about menopause, it's really the final or the cessation of the periods for a woman. If a woman has taken 12 months without any period, we say that she has gone into menopause. And usually this should happen naturally between 45 years to 55 years in most women, but for some people it may happen a little bit earlier, which we don't consider to be normal. So things, maybe other definitions which are close to menopause, we have perimenopause. Perimenopause, for it is a period of transition from the reproductive years of a woman to the non-reproductive ones. So it precedes the actual menopause. Before that final menstruation period happens, a woman may start experiencing features or signs of menopause, like the hot flashes, the irregular periods. They usually start earlier than that time before the final period comes on. Someone may have a reduction maybe in the sleep because of the disturbances with the hot flashes in the night. They may have mood changes. All those, menopause comes in because of the decline of the hormones as the woman gets older. Yeah, the hormones tend to decrease as the woman goes higher in age. Yes.
So maybe, okay, now there is that you've said. What particular hormones have got a role to play in this? Because it will also help people to understand. Because there's a time somebody pulled off a funny joke and they put, it used to be, how should I call it? it was like our lunch basket or lunch pack, those ones, the Busero. Yeah, and they were very common among us kids of Nakasero Primary School, Shimoni, Buganda Road, you know, and there were those little lunch packs. Now, they were like our lunch packs. Now somebody says, if you once held this basket and by now you're still alive, you should be using supplements. So there are some who think that they use a supplement, then they're able to cater for that hormone that they are dropping. What particular hormones have a big role to play here?
So just like last week, we dug deep into the different hormones in a woman, right from the hormones which send a signal from the brain to the ovaries. Usually the hormones which go low are the hormones in the ovaries, that is the estrogen and the progesterone. So you find they are sending a signal to the brain to produce, for them to produce, for the brain to send a signal such that the hormones increase, but that signal no longer works as someone gets older. So the estrogen and the progesterone are the most important hormones for the woman in order to remain as a woman, to increase the lubrication down there, ensure that you have a good skin texture, maintaining that beautiful skin everyone has in their younger age. Yes, so estrogen and progesterone are the biggest hormones which decline and affect the woman. But also men experience something similar to menopause, which is called andropause. For them, it is the testosterone hormone which goes down, and then they would have a reduction in the libido, a reduction in the muscle bulk. Yes.
Okay. Then there is also what they call the post-menopause. What exactly is that?
So just like I've talked about the perimenopause, that period that precedes the menopause, when someone has their last period, then the additional years, we say that that woman is in the postmenopausal period, is postmenopause. So usually the symptoms of menopause happen in the perimenopausal period and in the postmenopausal period. So they may happen between 5 to 10 years for a woman, and then later on they settle down and a woman is normal. But some of the changes may be really permanent if not dealt with well during those initial years of onset of the symptoms of menopause. Like the hot flashes may go after that time. They may last between 2 to 5 years and they go away. But for some people, they may stay on for longer. But other symptoms like bone loss, the osteoporosis, if not addressed with supplements at the right age, that is in the perimenopausal period, and within the first 10 years of someone going into menopause, they can cause weakening of the bones, which may be a bit permanent. So supplements are very important in the first 10 years of menopause, or even like 5 years before the actual menopause, when someone has started experiencing the irregular periods, because they prevent the biggest impact, like on the bones. They help to, because it's these hormones that help the bone strength to remain good. When these hormones are in good balance, when you're still younger, they ensure that the bone activity, the breakdown of the bones, is not too bad, is not too much. But when they are low, that effect is very much during the first 10 years of menopause.
Now I'd like you to dive into the symptoms, because there's certain times people really need to help. We need to help the women identify, because there's certain times certain things are happening to them and they just do not know why. And the worst case scenario is even the partners around them do not know what exactly is going on.
Yes, so the symptoms of menopause, the commonest is how will someone know that they are approaching menopause? If you've reached maybe about 40 years, the menopause years differ depending on your family. If your mother reached menopause at 50, you're likely to be in the same age range of experiencing the menopause. If they had it a little bit earlier, you may be at risk of having it that early. So the earliest sign someone can start thinking, if they reach around 40 years, if they start missing their periods, they need to be suspicious that menopause is clocking. The biological clock is really clocking. Then So someone, as far as the irregular periods are concerned, they may start by missing 1 month, then it gets worse with time. They start missing 2 or 3, then they miss 6, then eventually the period, they take a year without periods, which is the term menopause. Then other symptoms, people may experience hot flashes as early as 35, 40, even before the actual menopause. So that should signal to someone that menopause is around the corner. Someone may start having reduced sleep, suppression of sleep. It may signal to someone that the biological clock is still, she's almost hitting menopause. So they may need to start looking out for the information and understanding really what is going on with their bodies. Basically, the hot flashes, the irregular periods, and the sleep patterns, mood changes. Some of the
brain fog one of them?
Brain fog, it is, but really a lot of, I must say that menopause affects all organs. It affects all organs, but some organs are affected more than others. Yes, but as you grow older, obviously the brain function will go down a bit, and it is part of the menopause as well. Okay,
now maybe you might need to explain a bit about when you talk about a hot flash. What do you mean by a hot flash? Because somebody will say hot flash, it just doesn't sink in.
So hot flashes, we mean someone is feeling hot in 1 minute, then feeling cold the other minute. Like a certain kind of heat comes over someone for a few minutes and then it goes away. Some people may experience it more in the night, where someone is relaxed and they are perceiving it more, but it can happen any time of the day. And usually it happens because of the reduced hormones. Usually it is the brain which sends a signal that you should be able to maintain good temperature. But as the hormones go down, they send that signal becomes a bit abnormal, and it may be sent at inappropriate times, and someone may experience the heat when they are not supposed to experience the heat. Basically that.
Okay, then we talk about other symptoms, or maybe it's also one of the symptoms or not. When we talk about depression, some people tend to get depressed. Can that be part of menopause symptom?
Yes. Generally, hormones are very important. The progesterone, the estrogen, they regulate the mood. They ensure that someone has good moods. But as you grow older, those hormones, when they reduce, the mood changes will obviously be there. So you find someone who used to be a bit calm is now maybe a bit quarrelsome, a little bit easily annoyed. It may bring about even some other psychological issues like anxiety. You're minding about your body shape. Some people actually, what I forgot about in menopause, some people tend to add more weight because the lipid profile, the fat content, the fat regulation tends to change because of these reduced hormones. And someone can add on weight. So it's the body changes, the body image. Maybe someone is struggling with low libido, someone is struggling with the vaginal dryness. It depresses them emotionally because of the changes that are happening, but also the brain activity may change somehow, and most women are at risk of psychological issues, which depression is one of them, and then anxiety.
Okay. Good morning, Dr. Moses. I hope you've joined us right now.
Good morning, Sophie, and apologies again. It's just that Wednesday happens to be my surgery day, and so I try and finish as soon as possible and come and join this call.
Okay, thank you so much. We do really appreciate, because I can imagine I see you already dressed in your scrubs, and I imagine who you've put on hold a little bit to be able to address some of the concerns here on the show. Thank you so much.
No. I've completed my list. It's all over now. I'm ready, and so I'll give this my undivided attention.
Okay. Now, of course, we're here talking into a subject or a transition that many women tend to ignore, actually do not know what is happening to their bodies, and that is the menopause. Because she was busy telling us about some of the other changes, and one of the changes she talked about was physical in terms of weight. Are there any other pronounced features that women can be able to identify and know, oh, this is what I am going through right now?
Yes, and I'm sure Dr. Judith has spoken about the changes like weight, the other what we call vasomotor symptoms like the hot flushes, the night sweats, and that's because of loss of the central temperature control. There are other, of course, there's the loss of libido, there's the brain fog that you have spoken about, there's exhaustion, vaginal dryness, because when a woman goes through the menopause, it's actually one of the things is that she stops. That's when she stops releasing eggs, but also her estrogen levels fall. They fall to very low levels, and estrogen is such an important hormone for the female. It allows for libido, a woman's sex drive. It also helps with moisturizing of the vagina, which helps with intercourse. And of course, if there's vaginal dryness, that makes intercourse more painful or uncomfortable for women. So those will be some of the physiological changes. They notice that one, their libido has gone down, and two, they find it uncomfortable because of dryness. But also another thing which maybe some people overlook is estrogen is very important for bone protection, bone density. And as women go through the menopause, they become more prone to fractures, especially hip fractures if they fall. And estrogen is very, very important in that. But once you go through the menopause, the bones become more brittle and they can break more easily. And that can cause significant loss of quality of life in patients, especially if they break a long bone like the femur in the thigh or even the hip bones. Okay. And of course, there's also as they grow older, the curvature of the back. Because because of loss of bone density, you'll notice older people, they have a big curvature of their back, and that's because the spine is also getting weaker. The spine bones are getting thinner, and that's causing the curvature in the back, and they appear to be growing shorter, which they actually aren't. It's just that their body posture is changing.
Okay. Now, I'd like to ask, does menopause also contribute to certain health conditions in women, say like heart disease or any other complications besides some of the issues that you have raised?
Yeah. Estrogen actually protects women before they go into the from a lot of diseases. One which you have touched upon is heart disease. And that's why we know that women when they're younger, even when they have other risk factors like smoking or overweight, have less chance of having heart problems compared to men for the same age. But once they go into the menopause, their risk of having heart disease and cancers is almost the same as men's after the menopause. So estrogen has had that protective effect. It also protects against things like diabetes, type 2 diabetes, and there's a whole host of depression as well. It protects against depression in women before they go through the menopause, and so there is a whole host of conditions which estrogen helps protect against. Before, and of course, also, as I mentioned, bone fractures. All of these are protected by women before they go to the menopause. But unfortunately, when they go through the menopause, they are more susceptible. They get the same risk as men. But the good news is there are solutions for this, and such as things called hormone replacement therapy, which we can give women. It can be tablets, it can be gels, it can be implants to make it more comfortable for women, and these then reverse the effects of the menopause, such as the loss of libido, such as the vaginal dryness, and also gives you relief from brain fog. It lifts the mood, so there's less depression, protects against bone loss.
Okay, you've talked about hormone replacement therapy. It is just supposed to help you move through the transitional stage clearly, right? Without any of those, but maybe you might need to help us understand. Someone might think with the hormonal replacement therapy, that means now I will not go through menopause and then hippie, I stay young and go through life or sail through life normally.
You're very right. Hormone replacement therapy is supposed to help through a transition phase when a woman goes from having her normal regular periods and going into after 12 months of not having her period. That's officially what we call the menopause. However, HRT, which does help with this transitional phase, does have its drawbacks. And this is if you take HRT for more than 5 years. The main drawbacks are the increased risk of things like breast cancer, increased risk of things like ovarian cancer, and cancer of the lining of the womb. And so the advice is to take HRT for a maximum of 5 years and then see your doctor to see whether you still need to continue on it. Now, there are some patients who take it for 1 year and they're happy and they have gone through the transition and they no longer require it. It is different for different women. It's not like all women will need it for 5 years. Some will require longer, some will require much shorter. But during that time, it's important to it's important to also adapt lifestyle changes. Things like if a woman is exercising more, one, she'll control her weight gain, but also it will strengthen her bones to make them stronger. She can also start taking supplements like vitamin D and calcium, which can help again protect against bone loss. So there are lots of other additions. A diet that is high in calcium, high in multivitamins, decrease alcohol intake. All of these can help during the transitional phase to a more healthier person after they have gone through the menopause and maybe when they've stopped taking HRT.
Okay, now I get to you, Dr. Judith. What health screenings should a woman prioritize during this period or during that phase, say from the period of perimenopause, menopause, then to, are there any specific health screenings that they should prioritize in their lives?
Yes, as a woman grows older, risk of most cancers increase. Cancer of the breasts, cancer of the cervix, cancer of the lining of the uterus. So if a woman is considering maybe using the hormone replacement therapy, we usually advise screening for breast cancer through a mammogram. If they are above 35 years, usually they will require a mammogram. If they are younger, usually they require a breast ultrasound. Then for cervical cancer, we recommend a pap smear, a cervical smear to screen for cervical cancer. If someone has had a history of endometrial hyperplasia, that's an enlarged uterine lining, would recommend other screenings like endometrial cancer screening. And some of these cancer screenings can be done even in blood. There are tumor markers which can be done to screen, but some may be really physical, like cervical cancer screening. We have to take off a sample from the cervix itself. Then the mammogram, you have to do the imaging. It's more of an X-ray, but people should not fear a mammogram. It doesn't have very strong X-rays like for most other X-rays, like for the bones. It has very little X-ray to help create images and know that there are no masses in the breasts. So basically it would be a cancer screen. Then whenever there is an abnormal discharge, someone would need to do an infection screen on the swab, vaginal swabs. Then Other screenings could be blood pressure screening. As someone goes into menopause, the risk of comorbidities increase, the other illnesses, just like Dr. Moses has talked about, the diabetes, also the risk of high blood pressure increases, the risk of abnormal fats increases, so doing a lipid profile would be important in this age. Yeah.
Okay, then talk a bit about the kind of diets.
So as a woman grows older, or even men, everyone, as you grow older, really beyond 40 years, you should eat less of the red meat. The white meat provides better essential fats with less cholesterol. So would recommend white meat compared to the red meats, and then a diet rich in vegetables and fruits. If you're having your plate, a half of it ideally should be fruits and vegetables. Then little you cut down on the proportions of the carbohydrates you take, cut down on the fats you take as you grow older. That's really the recommended diet.
Okay. Now coming to you, Dr. Moses, I believe you must have had lots of myths and misconceptions about menopause. What could be those outstanding ones, or those that commonly people tend to say about menopause?
People tend to say, one does. I think one of them is really about couples in a relationship. Can they continue having sex after the menopause? And there are some people believe that once they go through the menopause, they can no longer have a healthy a sexual relationship with their partner. That's not true, actually. And again, there are some people who menopause affects them a lot, and they need things like HRT. There are others who don't. But you can continue having a healthy sexual relationship with your partner even when you've gone through the menopause. Either you can have things like HRT, which can help, or for those who don't want to have hormones, they are things like lubricants, which can be used when you're having sex. Diet and exercise, as Dr. Judith has alluded to, these will help again with coping with the symptoms. And so the myth that women cannot have a healthy sexual relationship after the menopause is not true. They can, and there are lots of things that we can do to help, such as with lifestyle changes, diet, exercise, but also with HRT or even other lubricants that can help with this.
Then what about the bit like you've seen some couples, marriages breaking up, but because maybe the male partner does not seem to understand that the woman is going through menopause, and neither does the woman actually know that she's going through menopause. And one of those that normally contributes to that are the mood swings, the high tempers, and they just don't even seem to understand what's going on. What's your advice to the men?
Firstly, before I even jump to the men, there is the myth that menopause only occurs when you're very old, in your 50s and 60s. That's not true. There are some women who unfortunately go through the menopause when they're younger, when they're in their mid to late 30s. We call that premature menopause is the word that was used if you go through the menopause before the age of 40. So it can occur, and there will be men who are caught out with their partners going through these changes, and that can be quite a surprise for the men and also for the women. They go through these mood swings, they're getting these hot sweats, they're losing their libido. So this is something that is important for both the male and female partners to be aware of and to cope. And you're right, with the male partner, it is something which many of them would have not heard about. I find many male men have not had, whereas females, they would have had friends or would have had their mothers tell them about what to expect with the menopause, or they have read it in magazines. Men would not have received this, and so it is if any men who are tuned into this, it's very important to know what the symptoms are, such as the mood swings. Someone Unfortunately, some women will lose their tempers more easily. They'll be forgetful. They'll be more irritable. And also they may not easily want to have to be intimate. So it's important that you support your partner, understand her, understand if she wants to go and see a doctor to get some help with this transition, and be there for her as she goes through this, because it is a milestone in her life, and a change that almost all women will go through at one point.
Okay. So you did mention about and they say one size doesn't fit all. In terms of the supplements that women can be able to use if one cannot afford hormonal replacement therapy, what are some of those additional supplements that women can be able to use to enable them ease through the menopause period or transition properly?
I think the one thing which I get approached about by some women who don't want to go through or use HRT, and by the way, HRT is not that expensive. I think maybe that's another myth. There are lots of different types of HRT, from tablets to implants to gels to patches, skin patches, which can last over a month. And they're not that expensive. So one thing people should know is see a doctor, let them discuss what options are there for you, and then you can also discuss what the prices are. It is very important to know this. But for those people who don't want to use HRT, the most common thing that women have asked me about is lubricants, and I think in Uganda there are many different ones, but the one I most commonly remember using is KY jelly. I don't know if any of the viewers are aware of KY jelly, and this is a lubricant that women can use prior to intercourse. Also, they are condoms which are well lubricated, and those can be again used to ease friction during intercourse. And I can't think of any other option that can be used. But also, as I said, other things such as vitamins, such as exercise, these can help a lot in the. And there are also some plants. I think they call them phytoestrogens. So there are some plants that are rich in which are like a natural nature's estrogen. Things like soya beans are quite rich in phytoestrogens, and these can help again act as a more natural substitute to HRT, which some women don't like because of the association with breast cancer or ovarian cancer, and so there are many options, and I really stress. Don't think that everything is either HRT or is very expensive. Do see your doctor. There are alternatives that we can discuss and find a solution that is suitable for almost anyone.
Okay. Now you've mentioned something that I find quite amazing and I believe is affordable. Just shed more light on soya bean, because you talked about it, and it's one of those things I think that is very much available on the market here. In what format should the soya bean be consumed?
That's a tough question for me. It's not only soya beans. There are many other plants that are believed to have these phytoestrogens, which are almost nature's natural estrogen. The one which I do know is I can try and look up which other plants have these natural estrogens. But as I said, soya beans is the one which I know that comes easily off the top of my head. I'd have to check quickly to see what other. If you give me 2 seconds, I'll be able to look up which other estrogens, which other plants do. Which form do they best taken? It's best taken if they're not, because people roast soya beans. That would actually destroy a lot of the phytoestrogens in them. You'd want them either steamed or in a stew, which would destroy less of them. roasting them would unfortunately destroy them. So one way which I definitely say do not take it is by roasting soya beans. That would completely destroy them. But if you have them in stews or that would be a better way to preserve them as much as possible. If you unfortunately, the best way of having the soya beans is if they were eaten raw, but I don't think that is I don't know any preparation of them being taken raw, but we do know there are many vegetarian substitutes. I'm trying tofu. Tofu is made from soya bean, whereby the soya beans are processed into a substance that can then be eaten. This can at least give you a lot of phytoestrogen, which without it being destroyed in the cooking process.
Okay. Now here we go. Hello UBC TV. Thank you so much for bringing us those educative programs with those specialists from Fiona Fertility Clinic. This is Godfrey from Mengo. Says thank you. Then good morning. Where can I get the supplement for menopause? That will be responded to. Then you have good morning. If I am 40 plus and having a normal period and I fail to conceive for some time, am I getting to menopause or will I conceive? There you go.
Sorry, I didn't get that.
She says that if I am 40 years plus and I am having a normal period, yeah, but I fail to conceive for some time, after getting to menopause, or will I conceive? Will she be able to conceive?
If she's still having periods like every month, she's not in the menopause, and her ability not to conceive is not related to her going through the menopause. There may be many reasons why she's not conceiving. One could be her partner's sperm count may be low. 2 could be her tubes could be blocked. 3, she is 40 years old, so even with her natural age, it's more difficult. I don't think she is, from what she has said, she's having regular periods. She's not in the menopause. So what I'd advise her is she can seek advice. She can come to us and we can investigate that, but it doesn't sound like she is in the menopause.
Okay. Then good morning, doctor. My wife is no longer interested in sex. When does menopause start? At what age? And are there signs that I can tell in my wife? This is Collins. Are there any signs and symptoms you can look out for? Then he further goes to ask, what treatments are available for painful intercourse? At what age or signs should I look out for as a husband? Now, this is a very supportive husband. By the time he's willing to go that extra mile, please respond to Collins.
So they as I mentioned, one of the things that happens with the menopause is a loss of libido, which he has described, and it could be one, just the natural loss of libido, the sex drive, but 2, also women are finding it uncomfortable. There are a variety of treatments available. If he wants to come to, and Dr. Judith will give our phone number. And we are happy to even do a 15-minute free consultation. If he and her call us, and then if they're more interested, they can physically come to the clinic. But there is HRT. We have estrogens that can be applied on as a skin patch. There can be tablets that are taken, and this would increase the woman's estrogen going around her body, and in turn, her libido can be restored. And also, it can help with lubrication of especially the vaginal area, and that can help with intercourse. So there are a variety of things available.
Okay, now to you, Dr. Judith.
One thing which he mentioned, is he said that what age the menopause, although the average age of the menopause is 53 years old, that's the average age. There are some women who might even go through the menopause in their late 30s, and others even in their early 60s. But the average age is 53, but it can happen at any time.
Okay.
Sophie, so there's just one thing I wanted to touch on, which I'm not sure if Dr. Judith did touch on. We are talking here about the natural menopause, which is most women go through naturally because they have run out of eggs. And that is the most common way in which women go through the menopause. But there are other ways women go through the menopause, and most of them are medically related. One of them is if patients have had chemotherapy or radiotherapy, especially to the pelvis, if they've undergone cancer treatment. Some of these cancer treatments can affect the ovaries, and this can make women go into a premature early menopause when they have this treatment. Okay, so that is one of the what we call medically induced causes of the menopause. There are some treatments for example, patients can have injections for endometriosis or injections for fibroids, large fibroids, which are trying to when a doctor is trying to shrink them. And some of these medications can cause women to go into the menopause. Most of the time, it is temporary. It is not permanent. And after 2-3 months of stopping that medication, they will revert back to what to the state that they were in.
Okay.
But there's also surgical. For example, women having a hysterectomy for maybe very heavy irregular periods, or even fibroids, or even for endometriosis, or even painful periods. And the doctor may do a hysterectomy where he may leave the ovaries. If he leaves the ovaries, then they don't go through the menopause. But also, if the doctor removes the uterus and the ovaries as well, then the woman will go into the menopause once she loses her ovaries. So these are, although they're in the minority, they are quite a number of patients who will go through a menopause, but it is associated with clinical intervention of a doctor.
Okay. Then I'll get to you, Dr. Judith. Good morning, UBC. Thanks for the show. I am Bona from Entebbe. I wanted to ask, is it possible for a 60-year-old woman to get pregnant?
Thank you very much, viewers, for your questions. 62-year-old, most likely they have gone already into periods. It would be hard to conceive naturally, but they can still conceive, maybe by IVF, where they may need to use the donated eggs, and then we can use the husband's sperms to create embryos, which are now put back into the woman. Yes, so that's the only way they can be able to conceive.
Okay, and then this is Rose. I am 40 and I'm still having periods, though the flow has reduced, but I no longer want sex. How can she be helped?
So for Rose, from how I'm perceiving her question, she's still having the regular periods, though maybe the volume has reduced. That's normal for the age. But reduced libido would be one of the signs that she could be in the perimenopause period, the transition. So usually if someone is still having their periods and they have other symptoms like maybe the hot flashes, they have symptoms like the vaginal dryness or reduced libido, we can address those particular concerns. There are different medications which can be given for the different issues associated with menopause. So she can reach out, she can be helped.
Okay. Then Dr. Moses, to you, good morning. I am 51 years old now and I wish to conceive. Is it possible at menopause? And how expensive is it?
Yes, it is possible to conceive at 51. We have had patients who have conceived, but most of them, actually all of our patients who have conceived over the age of 47 have conceived using donor eggs. I haven't had a patient conceive naturally with her own eggs over the age of 47, at least under my treatment. But it is possible, and we do have women even over 51 who have managed to conceive with donor eggs. We are happy to discuss if you're interested in our services regarding donor eggs, where we use if she has a partner, we use a partner's sperm to fertilize the donor eggs to create embryos and put them back into her, and she'll be able, if she has a uterus, she should be able to carry the pregnancy. It all depends, but the cost could be anywhere between 20 to 25 million shillings, I think. But it all depends on what the underlying clinical scenario is. But it is something that is possible.
Okay. Then you have a testimony here. Good morning. I went into menopause at 35 years. It's so stressful, especially at night, the sweats, the hot flashes, lack of good sleep, dryness, etc., even low appetite. On the contrary, I have lost weight though. That is somebody telling us about that. Some, it's more of weight gain. Then I don't know why the weight loss comes in. Then good morning. Now this one was already responded to. Then, hello, Lady Sophia. I'm 46 years. I'm experiencing extremely hot flashes, yet I'm seeing regular periods. Please help me. I'm dying. Please give us your phone numbers. Thanks. This one, much as she's experiencing regular periods, but the hot flashes have preceded. How comes it turns out? Please.
Yeah. So there have been two questions. One, which are closely related. One is the patient who was having regular periods but had a loss of libido, and then this patient who's also having regular periods and having hot flushes. As people grow older, as women and even men grow older, you do find there's a decrease in testosterone in both women and men. And the testosterone is women do have a bit of testosterone, which is also important for their libido, and the same with men. And so, especially for that patient who says that she's having regular periods, but she has lost that urge for intercourse, it is worth her checking her testosterone level. And if her testosterone level is low, then it is worth, she could benefit from having testosterone supplementation, which is most of the time an injection or an implant. And that can help address libido. The other, also there are tablets as well. The other lady who says that she's having the hot flushes, although she's having regular periods, it would be worth us also checking her estrogen level, because if she does have low estrogen levels, despite her having regular periods, it could explain why she's having these hot flushes. And but if she's trying to conceive, then it would need to discuss how to go about addressing her hot flushes when she's trying to conceive. But if she isn't, then we can give her estrogen supplementations and supplements, and that will address her hot flush symptoms.
Okay. Then you have this one. Oh, okay, please.
Weight loss.
Okay, the one of weight loss.
Yes.
On the contrary, instead of putting on weight.
So some people, if you lose weight, instead of when the menopause starts and the hormones have reduced, most people gain weight. But other people may have weight loss, though it's not so common. But such a person would need further assessment, maybe with the thyroid hormones, if they are okay, or if there are other associated factors that could have caused the early menopause. So such person would need assessment.
Okay. Then you have good morning to you all. I am Shanita from Chireka. I'm 25 years and I'm not seeing my periods, and I'm not on family planning. It is now 9 months without seeing my periods. Dr. Moses, would you like to give that a go?
Yes. Now, if she's just not having periods, it could be, there are also other conditions that cause a woman not to have periods, but she's not in the menopause. The most common is something called polycystic ovarian syndrome, where actually it's the opposite. The women have a lot of eggs and they're not releasing them. Okay. But one thing which they don't have is the loss of libido. They don't have the hot flushes. They do have weight gain. They don't have the mood. They don't necessarily have the mood swings. So it is for her. It's more likely that she has something like polycystic ovarian syndrome, and this could be why she has no periods. And we can assess her and make an accurate diagnosis. There are other things that could be causing this, but as I mentioned, polycystic ovarian syndrome is the most common, but there are other endocrine conditions such as hypothyroidism or hyperthyroidism, which again affect the thyroid gland. But these things are interconnected to the functionality of the ovaries. These could make a woman not have any periods, especially a young woman at the age of 25. It is possible as well to go through the menopause at the age of 25, although this is extremely rare. But if she's having other things like the hot flushes, then let her get in touch with us. whatever the underlying cause is, we'll be able to investigate and also appropriately treat.
Okay, then I get to Dr. Judith. This is a gentleman who is asking for what supplement, especially for hot flashes. Then Dr. Moses will respond to one who is saying, what supplement for those who lack sleep? I'll first get to Dr. Judith, the one for the hot flashes. They're asking what they can be able to use because he says it's what my mother is suffering from.
With the hot flashes now, we have to assess the patient and know if they have any other symptoms, because hormone replacement therapy would be the best at managing hot flashes. But if someone is at the age of like below 60, it would be fine. But for older patients who are above 60 years, it would put them at risk of other issues like cancers. So we would need to know the age of the patient and advise better.
Okay. Then what about Dr. Moses, the one who said, what could they use to manage the issue of lack of sleep? By the way, because some of them actually resort to taking now the sleep pills, which I think is not advisable. Okay. Kindly guide.
Yeah. Okay. And this goes back to the question you asked me about what are the natural estrogens. As I mentioned before, this soya beans is a good source of phytoestrogen.